Hi, this is Eric Stoller here for the Eric Stoller Show and the Patient Zero series with Dr. Alan Bauman from Bauman Medical. We're so excited to be with you here today, Dr. Bauman. You have done over 34,000 patients, 12,000 PRPs. The numbers are astounding. Voted #1 hair restoration, only one of 200 experts like yourself in the country. We're so honored to have you on the podcast. Tell me one thing. How did you get started in the hair restoration business?
Well, first of all, thanks for having me.
Oh, my
I really
pleasure.
Appreciate it. It's great to have you here, Eric.
Thank you.
And to see the home office here, the mothership, Bauman Medical Hair Transplant and Hair Loss Treatment Center. But that's a question I get a lot. How did I get started in hair restoration?
Yeah.
And it really didn't, it wasn't my first love. I didn't know much about hair transplants when I started in my journey towards plastic surgery.
Okay.
So I was mentored by a plastic surgeon at a pretty young age, really before I could drive a car.
Wow.
And went to medical school, internship and residency, always thinking that plastic surgery is what I was going to do, until I met a patient who had had a hair transplant.
Okay.
And it was probably just like everybody else. In the mid-1990s, I was thinking that it was going to be pluggy looking, maybe painful, like, why would you ever do that? Why would you ever have that? And his results looked amazing and completely fooled me. His hairline looked incredible. And we had a little conversation about where he had it done, and from a layman's point of view, what it was like to go through the process. And what he imparted to me also in that short conversation was how it changed his life.
Wow.
Emotionally, socially, professionally. His life was never the same again.
So, and it's amazing, self-esteem, all of that changed.
So I knew that through plastic surgery that we were going to see some changes in terms of people's life, quality of life. I just didn't understand that the hair transplant could be so undetectable and natural. And so I decided, well, maybe I should go check that out. And so that's how it started on the path.
So it started, and then your journey on how did you then say, I've got this vision to create this unbelievable, let's call it the mothership of hair restoration and surgery. So how did you get the vision to create all of this?
Well, it didn't start as a 12 or 13,000 square foot facility.
I'm sure.
When I got to Boca in the 1990s, I moved down from New York after my training, after my fellowship. My wife and I came down, and we started the practice in 1,000 square feet.
Wow.
She answered the phones, I did the consults, and we got the teams to come per diem to perform the procedures with me. And it just grew little by little. But the focus was always get a phenomenal result, an excellent result for every patient, and to provide an amazing experience. Yeah, and so it just grew from there.
So that's so cool, because I know we're going to get a chance firsthand in a little while to see that on what you guys have, because it's truly amazing. I know we've seen you guys at the shows, and you're speaking at the shows, but to come to your house where you really do the work, it's really amazing. So congratulations on what you've accomplished.
Thank you. My parents say it's a 25-year overnight success.
That's right. We're all exactly. That's how it goes. And the bottom line is that, so if somebody's coming in here, tell me what are some of the things that you recommend, because you said a lot of times it's people don't know that they're having hair loss. And so what are some of the things, the signs that you look for that somebody needs to come in and get a consult with you?
Yeah, so first of all, hair loss can happen in men and women, and it can look a little bit differently. In men, you can see a receding hairline, thinning in the crown. It can progress to total baldness. In women, it's a little bit more subtle. It can be more like an excessive shedding in the shower, decrease in ponytail volume, a widening part line. And then it can recede the hairline as well in the temple areas. So really, what I like to tell people is that if you're starting to see some early signs, we need to take a look at it. Okay. And so the evaluation would include some measurements, obviously, of what the hair density is in different areas of the scalp, but also what I would consider more a holistic approach. So a 360-degree approach to your lifestyle, including your nutrition, your sleep habits, exercise, exposure to toxins, your hairstyling habits, even your scalp health is critically important when it comes to what's going on in terms of the function of the follicles up there on your scalp.
Now, you said something earlier that that time equals follicles. Yes. And I know this month coming up in August is Hair Loss Awareness Month. Correct. So let's talk a little bit about that, because everybody's on the go, and I'm sure a lot of your patients are people that are, 40s, 50s, 60s, and they're so busy, and they'll get to it. And they never get to it. I have friends that in their early 20s had a beautiful head of hair, and all of a sudden they're completely bald. So, let's talk about that. Time equals follicles.
Yeah, so what that means is that there's a bit of an urgency, that you need to take some action. That hair loss, like most of hair loss that we see in the practice, is hereditary. That's chronic and progressive. It gets worse with time without treatment. So the earlier you seek evaluation, a measurement, get a baseline measurement, and start therapy, the better off you're going to have in terms of keeping your existing hair growing strong and reducing the need for more invasive procedures later on, like a hair transplant.
Right.
So you got to get on it quick. That means time equals follicles. So every day, week, month, year that you either deny it or not treat it, your hair loss is getting worse.
It's getting worse and worse, and obviously as we get older, things get harder to regenerate.
Sure.
And like you said, back years ago, people had the plugs. I know people that had that. I guess some of the non-invasive would be like a PRP treatment. Would that be something that you would recommend first? Or?
Well, today, we started talking about the lifestyle changes that can affect your hair. So we start there first. But there's certainly non-chemical, non-invasive therapies and treatments. So everything from good nutrition and scalp health and scalp hygiene is important. And then non-chemical therapies like low-level laser light treatments are something you could do at home. And those are now FDA approved for hair regrowth. Treatments in the office like PRP, platelet-rich plasma, TED, transepidermal delivery. Those are like lunch break treatments that can help your existing hair grow stronger and thicker over time.
Got it.
But if the follicle's dead and gone, then we're going to do minimally invasive hair transplant. So it's not plugs anymore.
Right, sure.
Not 30, 40 hairs at a time.
As you said, that's the big change.
Right. So we're moving single follicle or follicular units out of the back of the scalp into the hairline or the thinning or balding area, literally as small as a single follicle, one at a time. So that's done through a large team to help me do some extraction. I'm going to make every single site where the hair is going to be implanted. That determines the artistry of the result, how the hair looks when it's all said and done. And the process is completed in a number of hours. It takes some time to get the job done. It takes about 6 days to recover, and then the hair growth starts to grow in at about 4 to 5 months.
Wow.
And a full year to see the final result, which is permanent, by the way.
Well, that's amazing. If you've taken your whole life to lose the hair, and within 6 months to a year, you're going to have a full head of hair back.
Well, some people need more than one procedure, so don't promise them one and done, please.
All right.
Some people have extensive hair loss, like my dad. Before he got started with his procedures a couple of years ago, he needed about 9,000 grafts. And so that was multiple procedures over time to get to the full coverage that he needed.
So depending on what your situation is. So it goes back to this. So here's what I'm going to suggest. Dr. Bauman, if somebody wants to come in and find out where they are, like find out what's going on, get the evaluation, do the measurements, how do they go about doing that?
So the best place to find all the information about hair loss and hair restoration is at baumanmedical.com. There's thousands and thousands of pages of information I've personally written, hundreds of hours of videos where people can learn about the causes of hair loss, the treatments that we have, everything from medications to the lasers to the regenerative therapies to the transplants. And then how to maintain their hair over time, it's all right there. If they want to start at consultation, as many of my patients do from their home or phone, from thousands of miles away or just a few blocks away, they can start there at the website, baumanmedical.com. Even if you just want to ask a question, you can go to baumanmedical.com/ask, type in your question, and I'll get the info right out to you.
Wow, amazing. So you can get your information answered, your questions answered. Also, you could set up either a phone consult, a Zoom, or if you're here, set up a consult. I believe there's a booking link that they can go to and book their appointment. And I'm sure your team is going to do a follow-up to make sure that they're coming in. Listen, this is serious business. Dr. Bauman is one of the top hair restoration surgeons in the country. So you're going to an amazing place. And in a few minutes, we're going to take a tour, and we're going to really get a chance to see what actually in action, what a treatment would look like from an analysis, right?
Oh, we're going to put you in the hot seat.
All right.
We're going to look at your scalp under the microscope. We're going to count those hairs. You're going to get the whole deal, everything.
The whole thing is going to happen. And we're going to talk a little bit about the partnership with AI Wellness and their amazing product that they have with your avatar, and of course with the AI mirrors, which we're going to get to educate patients as well. So we're going to also bring that in with their amazing team. I just want to give you the final word before we wrap up, just to encourage people, if they're thinking about it, they're watching this, to make the leap, to say, let me go take the leap and make an appointment to get myself checked.
Yeah, I think it comes full circle. You know, we talked about the emotional aspects first, about
Yes.
how hair loss can affect you. Hair is an important part of how we look and how we feel. So it can be something that can weigh heavily on your mind if your hair is changing. And so, as I've said before, time equals follicles. If you are out there with some thinning or shedding, or you're seeing some changes in your hair texture, your color, the coverage on your scalp, take action, get an evaluation. I look forward to helping you.
There we have it. Thank you, Dr. Bauman.
Thanks, Eric.
Pleasure. Dr. Alan Bauman here at Bauman Medical. Come check out what he has to say. You heard it first. Click the link, get your appointment set up. This is Eric Stoller here for the Eric Stoller Show on Patient Zero, wishing you the best and see you the next time.